Good morning, colleagues, and welcome to this PanCap webinar on Click Connect Care, Bridging Gaps with Telemedicine in Clinical Practice in Guyana. Welcome on behalf of PanCap, the Pan-Caribbean Partnership Against HIV and AIDS, and we're happy that you're able to join us this morning for this really important topic. Before we go into the actual presentation, I have a poll that I'll share with you at this point. Please feel free to respond. It's a really simple poll. Do you have telemedicine in your country? Yes, no, not sure. So let me go ahead and launch that poll. Thank you very much for those who are responding. So while you continue to respond, I would share with you a few housekeeping notes. One, your mics are muted, and so you will not be able to unmute and contribute in that way, but please feel free to use your webinar panel or the dashboard that you have, your webinar dashboard, to type in any questions, any comments, any suggestions, and we will take them at the end of the session. At the end of the presentation, we have a segment dedicated to responding to your comments and to your questions. Secondly, you will receive a certificate at the end of the webinar. You can use the certificate to submit to your medical councils for continuing education credit. For Guyanese participants, we have received 1 CME credit from the Guyana Medical Council. With that, let me go ahead and introduce our presenter. Our presenter is Dr. Bernard McDavid. He has been in medicine for a while now, but has worked in the hinterland regions of Guyana. The telemedicine program that you will hear about this morning actually is linking the hinterland with the coastland regions of Guyana, and Dr. Bernard will talk you through some of the processes, the benefits of telemedicine, how the telemedicine program has been set up. So we all know that, with COVID, there has been an increased use of technology, and I think that's one of the spin-off sort of benefit of COVID in terms of that innovation. And so, when you think about the benefits of telemedicine, you think about it from a patient perspective, you think about it from a healthcare perspective, and you think about it from the wider health systems perspective. From a patient perspective, certainly there would be improved access to care. So telemedicine is able to reach communities where there may not necessarily be a full complement of healthcare workers, but telemedicine can reach those patients with more specialized services. Because of the very quick access and because of technology and interconnectivity, etc., there's a benefit of convenience, and it saves time for the patients, for the healthcare workers. Being able to follow up certainly patients over time allows for good continuity of care. And when we've all gone through COVID, we know that with telemedicine, being able to provide a consultation remotely reduces exposure to infections. And so when we think through what are some of the benefits of telemedicine from a patient perspective, they're numerous, and Dr. Bernard will share good examples of how Guyana has implemented telemedicine and what we're seeing as the benefits. For the healthcare workers, indeed, there is going to be expanded reach to patients. There is good efficiency and workflow management when you think about the less time being spent on a lot of administrative tasks and preparing room and streamlining triaging of patients, those sorts of things. Some of that will apply to telemedicine, but indeed there is better efficiency and workflow management with telemedicine. A lot of telemedicine programs that have been implemented worldwide, many of those platforms integrate an electronic medical record system, and that in itself improves documentation and follow-up of patients. And we'll see some of the data that's coming out from the integrated electronic medical record system from the Guyana program. And from a health systems perspective, when we think about how beneficial this is to the health system, it is certainly cost effective because it will reduce things like hospitalization, admissions, reduce transportation costs, unnecessary visits to the emergency room. There may be a need for lower infrastructure and overhead costs, although you will see that there is a need for infrastructure to be able to set up a telemedicine program. I'll stop at this point, and to say that I'll hand you over to Dr. Bernard, who will give you much more of how Guyana has implemented their telemedicine program. What the poll is showing at this time is that one second, let me see, Dr. Bernard, for your information, 62% of our participants have telemedicine in their countries and in their programs. 14% are saying clearly no, there is no telemedicine in their program, and 25% are saying that they are unsure of whether they have a telemedicine program in their countries. And so over to you, Dr. Bernard. Dr. Bernard has been with the Guyana Telemedicine Program for some time, and he will share a little bit more on his experience with that program and give you an overview of the Guyana Telemedicine Program. Dr. Bernard?
Thank you, Dr. Shanti Singh, for that introduction. My name is Dr. Bernard McDavid, and I would have been serving in the hinterland in Region 7 for 2 years. I was first placed at Bartica Regional Hospital, and from there I went to Camarang District Hospital, and from Camarang I worked at Jawala Health Post. Working there, I've had firsthand experience of the difficulties that we face, especially physicians and community health workers, as it concerns health and getting emergency cases to Georgetown and to more accessible or more advanced areas where they can be managed properly. So this webinar is basically here to help us understand how we can bridge those gaps in helping persons who may not be able to access these commodities easily to be able to connect with somebody who could at least guide them and help stabilize a patient um, before before they are transported out to Georgetown, or if they would even need to be transported. So as we move forward today, we want to be more inclusive and have accessible care. And telemedicine is becoming not just a possibility, but a powerful necessity. So these are the objectives we will cover today. As you can see listed here below, we won't go through them individually. Just to start, here's a quick video of what exactly telemedicine is here in Guyana. It doesn't have any audio, you could just read the captions. So it says Guyana's population density is fewer than 4 individuals per square km, and many remote Amerindian villages are isolated from nearest health facility. It says in some cases, reaching the nearest health post by boat can take up to 5 days. And the Ministry of Health introduced a solution in 2022, which was telemedicine. And we used the Gale eClinics remote as a remote point of care platform. So patients can engage with doctors and specialists instantly. You could get live health data, and it's set up in over 50 remote communities all over Guyana. So in 2024, the Ministry of Health will be expanding telemedicine services to more than 50 locations. And there is the geographic information system, which basically tells you who is where and which health worker is working at which health facility. Okay, so that completes the video. So next, let's define telemedicine, and I'll give you a brief history of what telemedicine is in Guyana. So let's start with a simple definition. Telemedicine refers to the use of technology like phones, video calls, and digital devices to provide healthcare services remotely. It allows doctors to diagnose and treat patients without being in the same location. This is especially important in places like Guyana, where long distances and poor infrastructure can make accessing healthcare a real challenge. Telemedicine is relatively new to Guyana. It was first introduced in 2022 in a few villages in Region 9, aiming to serve our most isolated communities. Since then, the initiative has grown rapidly, and today there are more than 50 operational sites, and the government plans to expand to 80 and connect 300 facilities through satellite internet. A national telemedicine hub is also in development, ensuring that even our most remote regions can access 24/7 specialist care. So here is a map of Guyana showing you all the telemedicine sites all over the 10 regions of Guyana. With the GIS system, you can locate each health center and see exactly which community health worker is in which region. So why is it relevant? Because many of our people live far from hospitals, and traveling to Georgetown can be costly and time consuming. While telemedicine, with telemedicine, a mother in Letem, a teacher in Mabaruma, or a farmer in Anai can speak directly with a specialist in Georgetown, sometimes even with one overseas. It levels the playing fields, helping rural and indigenous populations access quality care without leaving their communities. The potential impact is profound. First, it improves early diagnosis and timely treatment, saving lives. Second, it reduces pressure on urban hospitals by handling manageable cases locally. Third, it helps train and support our local health workers through virtual collaboration. And finally, it lays the foundation for a digitally connected health system, one that supports national development and health equity. So next we'll be talking about some epidemiological statistics that we have using telemedicine. So Guyana faces unique public health challenges, sparse populations in the hinterland, limited access to specialists, and high rates of preventable conditions, which make it difficult to provide timely, equitable care. Often, people are referred to hospitals for minor issues simply because there's no one on site to confirm it's not serious. These unnecessary referrals overwhelm the system and delay treatment for others. Telemedicine changes that, and it allows doctors to access and manage conditions like skin infections, colds, and minor injuries without patients ever leaving their communities. Local health workers can consult a physician in Georgetown in real time, receive treatment guidance, and reassure the patient, often avoiding a long, expensive hospital trip. The impact is already measurable. Between 2023 and 2024, over 15,000 consultations were conducted across Guyana. More than 60% of these were resolved without a hospital referral, and a large portion involved minor ailments. By reducing unnecessary referrals by nearly 28%, telemedicine is not only improving access, but protecting hospitals from overcrowding. Let's look at Region 9. This was one of the first regions to implement telemedicine, and in just 1 year, they saw a 40% drop in minor case referrals to the Lethem Hospital. Health, assi- Health assistants used tablets to consult with doctors, who then guided treatment locally, and this empowered frontline workers and therefore improved care at the village level. There was no more waiting or long rides unless absolutely necessary. These improvements benefit the public health system as a whole. By treating cases earlier and closer to home, we reduce serious complications, save on transport and hospital costs, and free up doctors to focus on emergencies. Importantly, telemedicine also helps train and support rural health staff, giving them a direct line to expert advice. But we're only getting started. The plan is to expand telemedicine to all 10 regions, integrate digital records, and use real-time data to guide health policies with proper investment and training. This initiative can truly transform Guyana's healthcare landscape and will need partnerships with private companies, NGOs, and international agencies to scale substantially. And we have with the company 19 Labs, which enables us to have these devices in each region. So, as healthcare continues to evolve, telemedicine has quickly moved from a convenient option to an essential part of healthcare delivery, especially in remote and undeserved areas. We'll explore the core components that make telemedicine consultations successful, covering the clinical, technological, ethical, and communication aspects that must all come together to ensure quality, safety, and trust in virtual care. Let's begin by looking at the big picture. A telemedicine consultation isn't just a video call, it's a structured clinical encounter. It needs to mirror the quality and professionalism of in-person care. To get it right, we must focus on four pillars: clinical effectiveness, technological readiness, ethical responsibility, and strong communication. Each of these plays a vital role in delivering care that is timely, respectful, and effective. So here we're talking about the three pillars. So usually in the first picture, a telemedicine worker or a community health worker will take the vitals, assess the patient, and make a telemedicine request call in a group. At the control center, which is at the Ministry of Health, which you can see in the second picture, we will receive the request and tell the person to make the call. Here we'll make the consultation and give advice on whether the patient needs to stay in the community, can be treated there, or needs to be evacuated, or needs to have further management at a more advanced facility that can take care of that situation. And of course, medication delivery via drones has been implemented where small packages can be delivered in emergency cases to health facilities that need medication. From a clinical standpoint, a teleconsultation must begin with a thorough and accurate history. Without physical examination tools, we rely even more on patient descriptions and remote monitoring devices. It is also essential to have clear guidelines on when a virtual consultation should escalate to an in-person visit. And just like any clinical encounter, proper documentation, follow-up instructions, and coordination with other care providers remain critical. Technology is the engine that drives telemedicine. A strong, stable internet connection is foundational. Equally important is the choice of platform. It must be secure, user-friendly, and compatible with devices patients already use. Clinicians need proper hardware, cameras, microphones, and screens to access the IT support system, and especially in rural communities or resource-limited settings. Preparation and training reduce frustration and make consultations smoother for everyone. So these are some cases that I would have seen on some telemedicine consultations. In the first image on your left, this was a 44-year-old male patient that reported to the Philippi Health Post. He was cutting down a tree with a chainsaw, and when he was doing that, the chain from the chainsaw had slipped and it had hit his left, you could say mid-third of the femur. Um, Usually, this is how the interface is on a telemedicine consultation. So you could see it's from Philippi. Usually, they'll have details, the patient's vitals, etc. But the health workers were, I would say, they were overwhelmed, so they made the call without inputting the information, and they were asking for help. So from this, I was able to tell the health workers what to do, tourniquet the area that was bleeding, toilet it, give IV antibiotics, suture, and help to establish bleeding control. So these two pictures, the left and the middle, indicate that. And the right was a man who he was in the farm. This was at Kako village, which is in Region 7, and as well as Philippi. He was cleaning the area in his farm, and he had chopped his hand with a cutlass. And so he had a laceration close to the radial artery. So he was bleeding very profusely. So I told the health workers what to do, tourniquet the area and suture and help stop bleeding. These are some less serious cases. These are children from various villages that came with oral infections that could have been treated there if they weren't um, given a telemedicine consultation. They may have been referred out for something that could simply be treated with antibiotics or antifungals based on the clinical picture that you see there. So now let's talk about ethics. Just because we're meeting online, it doesn't mean professional standards disappear. Patients must be fully informed and give consent before engaging in telehealth. Their privacy and data security must be protected with the same diligence as face-to-face care. We must also be conscious of equity, making sure telemedicine does not exclude those with limited tech access. And above all, clinicians must take full responsibility for the care they provide remotely. Next, communication. Perhaps the most underestimated pillar in a telemedicine consultation, we lose some nonverbal cues, so we need to be even more intentional. Begin with a clear explanation of what to expect, use plain language, and listen actively. Maintaining eye contact, even virtually, and showing empathy help build trust. Always check that the patient understands what has been discussed and that they feel confident about the next step. So, how do we put all this into practice? We start with your setup. We want to choose a quiet, well lit, and private space. We want to test the tech before each session, and we can use a checklist to ensure that we cover key steps. We want to document thoroughly and schedule timely follow up. And most importantly, seek patient feedback. It helps us to improve and show that their experience with the technology matters. Telemedicine is a transformative tool, especially for reaching rural and underserved populations. It bridges access gaps by connecting patients to care without the need to travel. Some of the key benefits include increased convenience, better chronic disease management, and reduced healthcare costs. However, telemedicine does have its limitations. such as reliance on a stable internet connection, potential digital literacy barriers, and challenges in conducting a physical examination. As we explore this topic, we'll look at both the opportunities and some small boundaries that come with adopting telemedicine in clinical practice. The most obvious benefit is access. For patients in remote villages or mountainous regions, seeing a doctor can mean traveling for hours, sometimes days. As we've seen in the video, it takes approximately 5 days for some persons to actually reach a health post. Telemedicine brings specialists into these communities virtually, and it means faster diagnosis, fewer missed appointments, and care that simply is closer to home. It's cost effective. Telemedicine helps to save money. It cuts down on unnecessary emergency visits and helps providers triage more efficiently. Health systems can allocate resources where they're needed most, and patients save on travel and time off work. Another major advantage is continuity of care. Patients with chronic diseases or chronic conditions like diabetes or hypertension benefit from regular follow-ups, and telemedicine makes that more manageable. It also makes healthcare more convenient. Appointments can happen from home, and there are shorter waiting times. Telemedicine is also a safety net in times of crisis. During the COVID-19 pandemic, it became a vital lifeline. And in places prone to natural disasters, telemedicine supports ongoing care when are flooded or clinics are unreachable. Now, let's turn to some of the small challenges. First, the technology gap. Not every community has stable internet or reliable devices. If the infrastructure isn't there, patients are left behind. And this digital divide must be addressed for telemedicine to be truly equitable. Telemedicine also has its clinical limits. You can't examine a lump or listen to the lungs through a screen. It's also more complex legally, and it brings the question who's responsible for the care. So how do we ensure consent, confidentiality, and proper licensing is achieved across regions? Then there's the issue of equity. Some patients don't feel comfortable with technology. Language barriers, digital literacy, and even cultural norms can limit effectiveness. We need to be careful that telemedicine doesn't unintentionally widen existing health disparities. Let's ground this into a real example. In Guyana, telemedicine is helping health posts in interior regions connect to specialists in Georgetown. These connections have reduced referrals and caught conditions early. While there are still hurdles like limited bandwidth, the impact is already visible. It's an example of how telemedicine, even in resource limited settings, can extend care in practical, life changing ways. Next, we'll talk about the knowledge and current legal, ethical, and regulatory guidelines as it concerns the telemedicine. So, as telemedicine rapidly transforms how we deliver care, it's essential that we keep pace with legal and ethical responsibilities that come up with it. Telemedicine offers remarkable potential, bridging geographical gaps, improving health, and expanding the reach of healthcare professionals. But, as with any innovation, it raises critical questions. Who is accountable? How do we protect patient privacy, and what laws apply across borders? In Guyana, telemedicine is still evolving. There's no specific law that governs telemedicine, but existing regulations like the Medical Practitioners Act still apply. This means that doctors practicing remotely must maintain the same standards of care and professionalism as they would in person. The Ministry of Health supports telemedicine, especially in interior regions, and pilot programs have begun. Across the Caribbean, the legal landscape is fragmented. Countries like Jamaica, Barbados, and Trinidad and Tobago are exploring telemedicine through pilot schemes and draft policies. However, most still rely on general health and data protection laws to govern telemedicine. This leads to uncertainty for providers working across jurisdictions. We urgently need regional alignment on licensing, liability, and cross-border care. So, ethically, these responsibilities are clear. We do no harm and we respect autonomy and protect privacy. In telemedicine, informed consent is crucial. Patients must understand what telemedicine involves, what risks exist, and what alternatives they have. Cultural sensitivity is also essential, particularly in Caribbean communities where trust, tradition, and language may shape healthcare experiences. From a regulatory standpoint, healthcare professionals must be licensed to practice in the country they serve. They must be also secure, have encrypted platforms in order to safeguard patient data, and clinical government frameworks like audit trails and risk management must be in place to monitor telemedicine quality outcomes. Even with detailed local laws, international guidelines from organizations such as the WHO, PAHO, help to shape best practices. Frameworks like the GDPR from Europe and HIPAA from US also inform how we handle health data securely and respectfully, even here in the Caribbean. However, several gaps do remain. Most Caribbean nations lack uniform legislation. Infrastructure is uneven, especially in rural regions. Many clinicians and patients are unfamiliar with teleethics or how to navigate virtual care responsibly. Without a structured approach, we risk deepening health inequities rather than solving them. But there is an opportunity. A CARICOM-wide legal framework could unify standards and support safe telemedicine across borders. Shared licensing, regional training programs, and standardized data could build a trust and efficiency. So next we'll talk about best practices in virtual clinical assessment, diagnosis, and follow-up with a strong emphasis on patient-centered care. As healthcare delivery increasingly moves online, it's critical that we maintain both our clinical standards and the human touch that defines good care. Virtual care is no longer an option, it's a necessity. Whether due to COVID-19 pandemics, geographic barriers, or simple inconvenience, patients are increasingly turning to telemedicine. So, what does patient-centered mean in the virtual context? It means truly listening to the patient, respecting their preferences, communicating with empathy, and ensuring care is tailored to their unique context, culturally, socially, and emotionally. Technology should support, not replace, the human connection. When assessing a patient virtually, we begin by verifying their identity and creating a comfortable, private environment. A detailed history is more important than ever, and we must pay attention to not just what the patient says, but how they say it. Tones, pauses, and expressions are especially important, and digital tools can help us monitor symptoms that the patient may present with. Diagnosis must be made with humility and caution, and we rely heavily on patient-reported information. So validating that information and knowing when to refer for in-person exams is vital. Follow-up is often where virtual care shines. Using technology to your advantage, such as text reminders, video check-ins, and accessible scheduling tools help maintain continuity. The tools we use matter. We need secure platforms that protect patient data but are also easy to use. Patients shouldn't need a degree in computer science to attend an appointment. And also, offering help, whether through written guides, phone support, or community tech programs, is needed. So, equity is crucial. Not all patients have fast internet, smartphones, or digital literacy, and we must adapt. We must offer alternatives like phone consultations and provide multilingual and disability access options. Telemedicine must meet the same safety and quality standards as in-person care. That means following guidelines, reporting adverse events, collecting feedback, and ensuring that every patient gives informed consent before proceeding with virtual service. Telemedicine holds immense promise, especially for rural, underserved, or remote communities. But without thoughtful planning, the promise can fall flat. So it may dive in to what gets in the way and how we can move forward. So telemedicine has the potential to bridge serious healthcare access gaps, and it can reduce unnecessary hospital visits as mentioned and connect specialists with remote patients and bridge services with people's homes. So infrastructure is one of these gaps that we can talk about. In many regions, especially rural ones, reliable broadband is simply not available. Without strong internet or electricity, video consultations just aren't possible. Health facilities may also lack private spaces for virtual care, making consultations uncomfortable or unsafe for patients. Now, even where the infrastructure exists, the right technology might not. Not every household owns a smartphone or a laptop, as we discussed, and some patients and even providers aren't comfortable with digital platforms. We may also face challenges and systems such as syncing the electronic medical records may be clunky or hard to use. On top of that, there's also the looming concern about data and privacy along with cybersecurity. There are also cultural and social barriers. Culture matters just as much, and some patients feel that the face-to-face care is more trustworthy. In others, language barriers or low digital literacy may prevent proper communication. And with the certain health conditions such as mental health or sexual health, there may be added stigma that stops people from using telemedicine. Building trust and adapting services to different cultural contexts is essential. System-wide challenges also hold us back. We still lack clear, enforceable regulations around telemedicine in parts of the Caribbean. Reimbursement models are unclear, and without structured training programs, providers may feel unprepared or unsupported. But we're not powerless. We can push for public investment in the digital infrastructure, especially in rural areas. We can create simple multilingual platforms that are easy to use, and training is key for both health workers and the public so that everyone has access to virtual care confidently, sorry. So culture-specific solutions go a long way. Let's involve community leaders in designing services, and this builds legitimacy. Over materials in so we want to offer materials in local languages and make them understandable regardless of education level. At the policy level, we must push for national standards for telehealth guidelines and sustainable funding models. We want to make sure that telemedicine initiatives are monitored and evaluated and not just launched and forgotten. So next, we want to talk about incorporating telemedicine tools and workflows. So telemedicine is no longer a luxury, it's a necessity as mentioned before. And by incorporating it, we can expand access to care, especially for rural and underserved populations. These tools range from secure video conferencing platforms, e-prescription systems, and mobile health apps, and technology alone can help with successful integration, which we must ensure that the tools align with clinical workflows, data security standards, and ease for both patients and providers. Incorporating telemedicine means rethinking how we schedule appointments, document visits, manage follow-ups, and coordinate with other care providers. Seamless transitions between in-person and virtual care are key to delivering patient-centered services by enabling real-time data sharing through electronic health records. Telemedicine significantly reduces the need for travel and long wait times, making healthcare more accessible and efficient for patients. It increases convenience and flexibility by allowing individuals to connect with providers from their homes and workplaces. Remote monitoring plays a vital role in promoting early detection of complications, allowing healthcare providers to identify and address issues before they escalate. As telemedicine expands, it's crucial to maintain strong data security and patient privacy to protect sensitive health information. At the same time, ensuring accessibility and equity is essential so that all patients, regardless of location or socioeconomic status, can benefit from virtual care. When properly integrated, telemedicine enhances care quality, boosts patient satisfaction, and improves long-term outcomes. It's a key step toward building a modern, equitable health system. So this brings us to the conclusion. In Guyana, telemedicine is helping bridge care access gaps, especially in rural areas. Early results show fewer minor hospital referrals and better chronic disease management. Its success depends on clinical accuracy, technology ethics, and clear communication, all which contribute to improved continuity of care and reduced travel burdens. In Guyana and the Caribbean, legal and ethical frameworks guide safe telemedicine use, while barriers like poor infrastructure and cultural resistance exist. Best practices such as structured assessments and culturally sensitive communication help overcome them. Integrating telemedicine into routine care boosts both patient satisfaction and health outcomes. Telemedicine has great potential to transform healthcare in Guyana. With the right tools, policies, and community involvement, it can sustainably reach underserved populations and strengthen the national health system. So this is just a video of everything that we talked about today. Okay, so I'll open up the floor for any questions if there are any. And these are my references that I would have used.
All right. Thank you very much, Dr. Bernard McDavid. That was really very, very comprehensive, and I do appreciate the time and the effort that you have put in really sharing every aspect, I think, of telemedicine. I just wanted to add one point to the comment on the legal frameworks. And you made reference to the Medical Practitioners Act, I think. In addition to that, Guyana passed its Data Protection Act in 2023, And with that act, it makes provision broadly, while it may not state, and please don't quote me on this, while it may not state that specifically telemedicine, but it does make provision for protection of data, and particularly protection of data in relation to health. And so, for example, when it comes to patients, the Data Protection Act makes rights for the patients to access their data, makes right for the patient to consent to have their data freely given or shared. And it also makes provision for healthcare workers in their responsibility to the patients. The Data Protection Act is very clear that consent has to be explicit from patients before collecting and sharing their data, and that if extrapolating from the Data Protection Act to telemedicine, then the patient must be informed why the data is collected, how it will be used, and how it will be shared if it is to be shared. Broadly, the Data Protection Act also speaks in terms of data that when collecting data, and if you apply this to telemedicine, then that minimum amount of data should be collected, not just minimum, but just what is necessary. And so if data is not necessary, there's no need to collect data. That all of the records have to be accurate that's collected and should be up to date. And of course, there should be limited access to patient data. That is, it should only be accessible to authorized staff and healthcare providers. And with any of these online data platforms, the way we collect, store, and transmit data is really important. And Dr. Bernard, you spoke about it, that it has to be encrypted and it has to be secured servers, all of those IT nuances in terms of electronic platforms and data, etc. So there is a very comprehensive data and new and progressive data protection act that was passed in 2023. Dr. Bernard, there is two comments, I think. One, just to say if you can share the slide with a map of the facilities, with the telemedicine facilities again. If you can go back and share that slide, Dr. Bernard, someone is asking. And I think while you presented that there are 50 telemedicine sites, from what I've heard most recently, there's 80 something. So the number of sites have gone up. And I've heard recently that for 2025, the plan is to double the number of telemedicine sites in country. Dr. Bernard, could you go back and share? Someone is asking if you could share the slide that you had with a map of Guyana and the telemedicine sites.
Sure. So here is the map of Guyana. The brown points show the telemedicine sites in region 1. The blue or the dark indigo color shows the telemedicine sites in region 7. The pink to purple color shows the telemedicine sites in region 8. The yellow shows the telemedicine sites in region 9. The light blue shows the telemedicine sites in region 10. The pink shows the telemedicine sites in region 6. The green shows those in 5, and we don't have a need for any telemedicine sites in region 4 or 3. However, there are some in region 2, which are shown in red.
Okay. Yeah, thank you, Dr. Bernard. I don't know if the participant had a follow-up question, but thanks for resharing the slides. I don't see any comments coming in, any questions coming in, Dr. Bernard. And so I think you did a really good summary in putting together the key points of the presentation. And so I don't wish to recap any of what you have said, but just to say thank you very much for sharing Guyana's experience. I have one question from my end, and that is, could you share with us what has been the experience in terms of patients? How receptive have they been to this? When this started, um, were there any concerns, any reservations, any doubts in patients' minds? How did you deal with those if there were, and how did this evolve over time?
So as it concerns patients, when they would make the call, um, it would usually be a serious case where the community health worker doesn't, or whoever is the health staff doesn't know exactly what's going on. So, for example, it may be a trauma, like the image that I showed with the guy that the patient. Let me see. Where is he? Is
The
it
one with the
here?
last.
Yeah. So they call sometimes, they don't know what to do, how to handle the case. So having somebody there that's calm, who may have seen these cases before and is able to guide you on how to deal with the situation, the healthcare workers are very receptive. The patients are they're very glad that somebody's there to help them and that they're not basically left without treatment, especially in some cases where snake bites are very common in these rural areas. You get calls mostly in the night because that's when patients usually get bitten by snakes or when they arrive at the health post. They're very receptive, they're very happy, they're very thankful for the information that you would get, and more than likely, when the patients are treated, they usually go home and they're not referred to Georgetown, which was usually the case before. So patients are very happy that they get treatment and that they are able to stay within their community, receive the treatment, and are able to go home within a couple of days.
Yeah, yeah. Thank you, Dr. Bernard. I just wanted to add also that I think, I don't know if you share this, if I missed this, but one of what I've heard from the community, which is really, on the side of telemedicine, is that because of the tremendous amount of IT infrastructure and internet connectivity that had to be placed in these communities, and I know this has been done with Starlink, what this means is that not just the health facility has access to internet connectivity, but the surrounding areas, and so it really provides internet also for the community within certain perimeter of the health facility, and so the community has access to internet, has access to information, which I also think is a good thing for the community. There's another question, a follow-up question to the MAP question, and the participant is asking if there are any private telemedicine facility in Guyana, or is it only through government?
So the map, these are all public health posts or health centers. There are currently no private areas that offer telemedicine. Um, so all these facilities are public health posts where anyone can go to receive a consultation. So I don't know if they wanted to know if the consultation would be accepted by a private doctor, but usually these health posts are public, established by the Ministry of Health, and the doctors that do answer the calls are employed or they work for the Ministry of Health. So right now there are no private institutions that do accept, make, or answer telemedicine calls.
Okay, thank you for that, Dr. Bernard. And also sort of another question from the same participant. The mention of prescription being available over the telemedicine platform, if you can describe how this process works.
Yes, so there are e-prescriptions on the telemedicine platform. So some health posts may not have some medications or medications that are niche to certain conditions. For example, I had um a patient that had chronic gout, and the medication that we would usually use for that is allopurinol. So the patient didn't have access to that medication at the health facility. However, there was a pharmacy that was nearby, so I was able to establish the prescription for allopurinol for that patient to receive at the private pharmacy. Another example is that some males may present with they may have problems urinating, and may present with problems like dysuria due to enlarged prostate due to BPH or benign prostatic hyperplasia. Um, so doxyzocin, which is usually not available at a regular health post, um e-prescription can be given to them so they can purchase it or get access to it at a more what we would say a central village that may have access. Guys are very rude with these medications because these area medication that are there does not we don't cater for cases that would be specific such as that. So usually, we want to give essential medications in these areas because getting the medication there is very hard. And even if we do get the medication there, it may expire because it's not used. So we definitely write and give e-prescriptions to persons so they can purchase these medications at private institutions or facilities.
Yeah, all right. Thank you, Dr. Bernard. For the participant that's been asking the question about the e-prescription and the private sector, if you'd like to have if a follow-up conversation, please feel free to reach out to you and we'll be happy to engage with you. For any of the other participants, if you have any questions, comments, suggestion, we will be sending out a post-webinar survey. You'll receive this as soon as we close the webinar. Please feel free to submit any additional comment or feedback that would be useful for us, or any questions that you would want us to respond to. We are at that time where we have to close the webinar. There are no additional questions, Dr. Bernard, but thank you so very much for sharing Guyana's experience on the use of the establishment and the use of telemedicine to bridge the gaps and to really advance Guyana's program to achieve universal health coverage, universal access, and universal health coverage. Colleagues, thank you very much for joining us this morning for this webinar. And again, you will receive a certificate in your email box and you will receive a survey. Please complete the survey and give us your feedback. Thank you all very much and have a good rest of the day.